Wow. I can see myself in the little screen in the mirror. Ain't that cool? Hello. So I've never used these earphones before. Can you hear me okay? Otherwise, I'll take them off. I don't know if you can hear me all right. Can somebody comment? Let me know if you can hear me okay. Hello, everyone. Uh, I've never used live with AirPods, so can somebody just comment and say if they can hear me or not, please? Hello, everyone. I'm just assuming that everyone can hear me. Loud and clear. Thank you, Pamela. Thank you. Well, I'm kind of just bored, and I was sort of thinking of something as far as being grateful for my life, my friends, my network of people that love and care about me. And also, I was down in Portland teaching a course this weekend, and I was having a beer with about 20 chiropractic students, and they were asking me about my business, they were asking me about my life, they were asking me about how what's my business philosophy, what's my life philosophy as far as like how do you build something from scratch. And the answer that I gave them was maybe a bit surprising to them. It wasn't marketing, it wasn't like SEO. It wasn't like that's Google stuff. It wasn't anything other than how you present yourself and your character. Now, what do I mean by that? Um, Basically, the philosophy that I gave them that resonated with some of them, some of them were surprised, was make sure whatever you're charging or whatever you're doing, you exceed the value by at least 30%. So that means that if someone, like for example, if somebody wants to approaches you to wash your car and they charge you much less than the next person and does a far superior job, the the person is going to get your phone number and then they're going to call you again, and eventually you can increase your price to the same price as your competition and or more, and your customer will exceptionally appreciate you because they know that you are doing far superior work to what you are charging. Now that goes along with life, friends, associates, business colleagues. If you give more than you request, you're always going to get that back tenfold, twofold. So when I'm working with patients, I mean, I those of you that have seen me before, I charge $300 an hour, and I have friends that in the industry that are like me, like kind of high end clinicians or strength coaches, and they charge much more. And they're always trying to convince me to increase my price, and I haven't yet because of things going on in life, stress, kids. I'm not as on top of my game as I should be. So therefore I want to make sure I stick to the rule that led to my success in the first place, which is always give more than you ask. And that's just a simple life rule that I tend to approach every single situation that I can. And so it's something that I thought that I would share because in this world of, I don't know how you would explain it, like dog eat dog, um, greed, and just do whatever you can to get on top. That is a very short plan. That's a very short-lived plan. But if you have a long-term plan where you genuinely care about what you're doing, and I'm talking about relationships with people in business and everything else, you will always have people that value you, and they will give because they value you as a person. And I'm sitting here being grateful, hanging out at my friend's house, um, and that was exactly the situation. I I just gave more than I asked for, and when I needed help, they always are there for me, and vice versa. So it's just a little bit of self-reflection, gratitude, and business life perspective that I felt like it was important to share with the world because you don't hear these things as much anymore. Most of the time, when you're talking about, say, business, for example, friendships, they're that aspect of things is being lost. You can call me an old soul. You can call me an old country hick. I don't care. Like that's kind of the way I was raised, and and yeah. So I really just wanted to share that message because it's something that I was taught by an old rancher when I was in college. I worked for this 92-year-old old rancher, still working on the farm, still driving a tractor, still getting up at the crack of dawn to work until night. I helped him harvest his mint. And that was something that he really said to me one day that really resonated with me. And I really stuck to it because um, I was really very impressed with this 92-year-old man just working because he loved it. And he gave back to the community, and he was loved by all. So it really touched me at the time. Yeah. So that was as I drink a White Claw or two. That was one of the things that I kind of felt compelled to share. Let's see. Yes. So I'm only going to respond to positive comments. I'm not going to respond to anything negative. Um, I'm past that point in my life. Dun, dun. For those of you that are new following me, which is quite a few recently, I am a sports chiropractor. I work with, just high performing individuals, anybody trying to increase their overall human performance. That includes athletes, celebrities, CEOs, um, book authors, that kind of thing. Let's see. You know, like I said, I'm only going to respond to positive comments. Yeah, I'm not talking about anything specific. It's just a general life philosophy. I'm not trying to allude to anything. I'm not trying to create hints. Just something as I sit in a house by myself because one of my friends is extremely generous in helping me and just trying to express gratitude and reflecting on how it is that I'm here. Indeed, father-daughter connection is very important, and I will absolutely spend as much time with them as I possibly can every single day. Um, Unfortunately, right now, and this is the true 2 years ago as it is now, I'm a very busy person and I have a very extensive schedule. Um, and one of the most important things that I can teach these girls is the value of hard work, work ethic, and character. And that's one of the most important things that I want to teach them because, in that regard, they can be self-sufficient. They can have that feeling of self-satisfaction. They can really hold themselves to themselves because you don't know what's going to happen in the economy in the future. You don't know what's going to happen with anything. But if you have the tools to survive and thrive, um, then it doesn't really matter. So I'll ask questions that are related to the positive side of things. Thank you for, and I will be doing more educational little instruction things on headaches and back pain and nutrition and pretty much anything you guys like. I've done one on the meniscus, I've done one on disc herniations, I've done ones on how um, arthritis and pain are not correlated statistically by the research. Sorry. Oh, I'm sorry, Charlie. You lost your husband. Um, Um, my parents are gonna come see Athena. My parents are still working. My parents are young. They're in their mid 50s. So, and they hate LA. So, they'll come down in the next month or so. Um, my mom was gonna come down this week, but with everything that's going on, she's gonna wait a little bit longer. So, um, Cheryl, if you've been in excruciating pain for the last 4 weeks and you can't bend forward, don't bend forward. That'll make it worse. Um, Go on YouTube and look up a prone press up. That's your best. That's not official advice, but it's probably the most likely helpful device. Yeah, um, this is a beautiful place. This is not my place. This is my friend's place. I could never afford this kind of place right now. LA is a crazy expensive. Um, I might heat up the hot tub and get in the spa though. Yes, the less I say in public, it's the better, and I learned that the hard way. And my talk is not about anything specific. It's not about my family. It's about my general life philosophy. If you have lower back pain when bending over, usually, and this is a very common problem, you're bending forward too much from your back. You want to move from your hips, so the crease. So if you move like you're trying to hover to pee on a public toilet, that's how you should move with everything. And your back will start to feel a little bit better. But stretching forward, none of that's going to help. It's going to make it worse. I love all the angry faces. It's great. You have rods in your neck and constant pain. What can I do to help my pain? That's a complicated situation. I don't have enough information to answer that question, but I feel for you. That's not fun. Mhm. You've been in prednisone for 10 years and I'm trying to get off. My body's in horrible pain. Um, yeah, I can't make any official advice about medications because I'm not licensed to prescribe medications, nor would I want to if I did. So sorry, but there's if you message me where you're at, I can find somebody that's really good in your area, hopefully, to help you out. Does an epidural cause back pain? It can. Again, if it causes scar tissue on your thecal sac, which is the dura mater, the skin that covers your spinal cord, it certainly can cause back pain. especially afterwards if you're talking about pregnancy. Dislocated right hip. It's really hard to dislocate a hip, so it's probably not dislocated. You probably just have hip pain. The only way you can dislocate a hip truly is generally a car accident. My thoughts on trochanteric bursitis related to cortisone. My thoughts are trochanteric bursitis is extremely overdiagnosed. If you have pain over the trochanter, they just call it trochanteric bursitis, and it's usually something else. The best advice I could give you right now is actually skin roll your entire back. You can look that up on YouTube, and your greater trochanter. Unless it's red and it's swollen and you can see it with your eyes, I would try that first. Mm-hmm. Let's see. Everyone's mental health is important, including mine. Acupuncture is good for muscle tension. Depends on the acupuncturist. Acupuncture, in my opinion, is a neurologically based treatment, so it can help in that way. Yes, Facebook algorithm loves angry faces, so please just keep doing it. Let's see if they actually stop. Oh, they did. Let's see. Well, here's a good one. I had 4 C-sections. At the last one, I'm having bad back pains. What can you do? Um, C-sections are really hard, and some reason in this country and others, we don't do any rehab for C-sections, but they cut through your core. Um, Go to YouTube and look up DNS, dynamic neuromuscular stabilization, like log roll or 4.5 month old pattern. That's a really good place to start. Mhm. It may be your kidney, or she sit or lay down too much. She needs to breathe and challenge her pain. Sounds like you got a therapist in the room. I'm not opposed to that methodology. I think you're talking about the pain science literature, which I'm very well versed in. But there's more options than that. 25 and the worst knees. I think you just messaged me. Knees are the easiest joint in the body, I think, to actually fix because they're really easy. You just got to restore the hinge and the rotation, and everything comes along quite well. Don't worry about the crack, snapple, pop. Mine do it too. So that's not an indication of a whole lot. My knees are killing me, and I'm told I need a total knee replacement. Um, how, Looking at your picture, you don't look very old. Basically, I can't give you any recommendations based on that, but it is possible to stop it, or at least prolong it. So if you want to get a knee replacement, you want to wait until about your 60s so that you don't have to do it again, and make sure you get the best surgeon you can possibly get if you have to do that. But based on what you're saying, I'm not quite sure. Mm, Sleepless leg syndrome, magnesium is a good place to start. Just a magnesium powder. Mm, Angry faces. So, All right. Well, I appreciate everyone. I am getting tired. I just worked all day again. Went home in the middle of the day to see my girls. And do I know any help with vertigo in Boston, Massachusetts? Not off the top of my head, but I could look. Vertigo is usually pretty easy. Just look for somebody that specializes in vertigo. That's actually if somebody actually specializes in vertigo, that's one of the easiest things to fix. What time do I go out every night and day? Depends on my patient load. Sometimes, like this morning, I had a patient at 7:30, and my last patient was at 7:30, so 12 hours, with about a 2 hour break in the middle. But some days I work 10, 12 hours a day. That's why I was never really on live or on Facebook or anything like that before my paternity leave, because I was busy. I was working. I was treating patients all damn day. But one of my passions in life is to share information and to help people. So I saw that this was a viable avenue to do that. So I'm going to do it a whole lot more, because I'm getting so many people that are um, reaching out to me and saying what I'm telling them, just simple stuff, is helping. So I'll just keep doing it until I don't get those messages anymore. Is cupping therapy, where did I go? Helpful? A good practice? Yeah, it is a good practice. I'm not a big fan of the bruising aspect of it, but to move the skin is super important. It needs to be able to breathe, it needs to be able to move. And I've actually invented a few techniques related to the skin, as well as work with people with like facelifts, liposuction scars, breast implant scars, quite a bit of things. So, yeah, cupping is a great. I just don't prefer the bruising. Just stick on the cup and move.